Public Advocate Jumaane sent a letter to Mayor Adams asking for more clarity on the plan and how it will be executed. And Mr. Williams is joining us this morning to talk more about this very issue. So good to see you, sir. Thanks for being here.
Always a pleasure. Thanks for having me.
So let's get into this, right? Because in your letter to City Hall, let's just throw it up for some of the viewers, you wrote this, saying, quote, "There has been widespread and understandable confusion and alarm among New Yorkers in the wake of your announcement, including from people who may share a goal of treating the mental health crisis, but believe that the proposed methods do not meet the practical constraints or ethical guidelines for care." So I guess, have you gotten a response, first and foremost, about that very letter?
We haven't gotten a response yet. We're very much looking forward to it. We don't want to confuse a tactic with a plan. And a tactic of involuntary hospitalization has always been available. When you have more answers about that tactic and when you have the police seeming to lead decision-making around mental health, it's cause for concern, particularly when you don't have as much detail on the continuum of care that's actually needed for those New Yorkers.
Right. And prior to Mayor Adams' announcement last week, you released a report on the city's response to the mental health crisis over a 3-year period. What did that report find?
What it found was, surprisingly, there was an over-reliance on police to address this issue. And I say that, of course, a little sarcastically, because that seems to be the response now, which we were very concerned about. We did see an increase in certain type of things like some center beds that have come online, but we saw things like having half of the respite centers that we had before 2019 right now. So we went, in some cases, in the wrong direction. And instead of really pushing investment in the right direction, investment in the continuum of care that's needed, it seems again that we're going to a go-to that has happened many times in the past, which is police being the lead, police being the ones making decisions on things that they're actually not trained to do.
Right. So in the wake of your report and the mayor's new mental health plan, of course, you and so many others pressing for more specific details, as are we in the media, asking for details on what exactly that training is. I had the MTA CEO, General Lieber, on my Sunday show, Picks on Politics. He talked about how these police officers are going to need to call clinicians who will give them the go-ahead on how to bring somebody in. But then there comes this whole thing of bringing somebody in against their will, right, and whether or not they really should be. Do you think it's going to open up the city to some lawsuits here? How do you see this playing out?
Well, first, let's talk about the reverse of what should be happening. We believe that mobile crisis teams, which is in the mayor's report, particular plan, there's no information on how much it's going to cost, how many they're going to be, but those teams should be providing the police information whether they're needed or not the reverse. And we are concerned about whether or not there will be lawsuits, and I'm pretty sure there will be. And look, this tool has always been there, and many folks have said, of course, it should be used when it's needed to be used. But if you're leading with that as the primary tactic of the plan, without actually talking about the care and continuum of care with the same specificity, it should leave a lot of people to be concerned and ask these kind of questions.
Right. Now, earlier this hour, we spoke with a doctor who talked about hospital staff. Everybody has their hands full with RSV, COVID-19, and flu cases. Beds are in limited supply. So has the city addressed how this new mental health initiative will impact those hospitals?
You know, it's a very important point, because even if you took at face value what has been announced, we literally don't have the beds needed to even follow through with that. We also have recommended that we need a different number for people to call so they don't get a criminal response to a health issue. You may not know, but the 988 national number is something we've been asking for a while on the city level. The city's infrastructure does not communicate very well with that national number. So there's so many other places where we could be figuring out how to build up the infrastructure and invest. And it is a difficult conversation. And it seems anytime we have a difficult conversation, we ask our police to do the job that we're failing to do. That's actually unfair to them, unfair to the New Yorkers who actually need the help, and the rest of the New Yorkers who want them to get there.
Yeah, and this has been something that has been talked about for a very long time. Decades, we've talked about the need for more mental health beds, more beds for those with substance abuse problems, right? These are not new issues. So I guess the question, Public Advocate, is, and I don't know if it's for you to answer or for someone else, where do we go from here? Because it's something that it just feels like the can is being kicked down the road and always talked about and never actually solved.
So what we need now is leaders to really say we are going to invest in this. On the state level, we have less than a third of the beds that were promised by this time. And the problem is the people who have the levers to get that money flowing, to get that infrastructure flowing, just are not doing it. And when that fails, those who are concerned, people who are on the train, like my family, say, we want these folks to get help. We just want them to actually get help. And moving people out of sight is not help, particularly when you can only hold someone for 2 days or so. Then they're going to be back out. And if they don't have the care and the continued care needed, we're not going to achieve the goals that I believe we all want to achieve.
Hopefully we can move the scale with this new plan. Public Advocate Jumaane Williams, thank you so much for being with us this morning.
Thank you.